Hi, continuing with our mental health awareness series, it's my pleasure to welcome Amy Clarkson. Amy is a board certified music therapist. She has over 20 years of clinical experience in music therapy, including working with children and adults with social and emotional challenges. She is also an adjunct faculty within the music therapy program at Montclair State University. Please welcome Amy.
Minnie, thank you for the opportunity to speak with you today about the important topic of music therapy and mental health. My name is Amy Clarkson, and I'm a music therapist and psychodramatist. I use music and action methods to support the process of growth and healing. And I work with children, youth, and adults with a range of life challenges. I'm also active in teaching and training students and professionals in the use of music and psychodrama for health and healing. I work alongside Erica Bogart, an art therapist, at Creative Flow, a creative arts therapy practice in Hillsborough, New Jersey. In addition to the individuals we serve at our office, we contract with several health and human service providers in New Jersey. In these current days, we're providing telehealth services. Mental health is an issue that touches us all in one way or another at some point in our lives. Recent studies have indicated that some 45% of adults in the U.S. have reported that their mental health has been affected by the recent COVID-19 outbreak. According to the National Alliance on Mental Illness, 1 in 5 adults in America experience a mental illness, with 1 in 25 experiencing a severe and chronic mental illness. Approximately 1 in 10 youth experience mental health challenges, and a staggering 70% of adults in the U.S. report having experienced some type of traumatic event at least once in their lives. Trauma can leave a variety of mental health concerns and scars. It occurs when a person feels powerless or is overwhelmed by events or circumstances with intense fear, horror, or helplessness. Anxiety is the most prevalent mental illness in the U.S., followed by depression, bipolar disorder, and schizophrenia. Often, addiction is co-occurring. More needs to be done in destigmatizing mental illness and in providing increased access to services. 60% of adults with mental illness did not receive mental health services in the past year. A word that stands out in thinking about how music therapy can help mental health is connection. Music has a connective quality, both internally and interpersonally, in ways that even transcend our current time of social distancing. Internally, as music is processed in our brains, so many areas of the brain light up and are responsive to the stimulus of music. One such area is the amygdala, the emotional center of the brain, which is also connected with memory and attention. The emotional resonance of music is one of the reasons it is such a powerful agent for support and healing for those with mental health challenges. I expect many of you who are watching this interview have had the experience of listening to a song or piece of music that evoked deep emotion in you. Perhaps that seemed to speak directly to you or express in some way your own story, your own pain, your own loss, your own joy. Such experiences of listening can help us to feel more connected to ourselves and to those outside of ourselves, giving shape and form and affirmation to a previously unnamed inner experience or feeling. In working together with a music therapist, people are invited to discover, choose, and listen to music that meets them where they are. Music that supports emotional awareness and expression, and that helps them feel less alone. Connection with others is an important part of healing and growth for those with mental health challenges, and really for all of us. Music listening also supports mindfulness, shifting negative, repetitive thought patterns and retuning in a way, learning to focus and stay in the present moment, slowing the breath and slowing the racing of the mind, while focusing on a new rhythm and a melody, and letting the music lead from a place of anxiety and tension to a place of calm. Music listening also stimulates the release of the neurotransmitter dopamine, which is associated with pleasure and positive mood. In music therapy, active musical engagement is often part of the work as well. The act of singing involves deep breathing and is experienced throughout the body. Singing leads to the release of endorphins, which in turn bring about an uplifted and positive mood. Singing can be an empowering and energizing experience for those who, for many reasons, have felt previously silenced. In music therapy, songs that are sung may be ones that were previously written, or may be original compositions developed by the client, the therapist, or both together. Experiencing the power and control to tell one's own story as you choose to tell it, using rhythm, melody, and song form, can be a very meaningful and healing experience. Sometimes in music therapy, we improvise music individually or in groups. When improvising, music is being created in the moment, often using percussion instruments that do not require complex training to access. There is an immediacy to this kind of music making that again is connective and energizing, that allows for expression of feelings that are harder to access and release through words alone. As Hans Christian Andersen famously said, "When words fail, music speaks." And as my sign here says, music is what feelings sound like. Issues of mental health impact the whole person, body, mind, and spirit. A holistic approach, like music therapy, is impactful because it reaches us as whole human beings, body, mind, and spirit. I encourage you who are watching to tune into the music that lives within you, with gentleness and kindness, to connect with the music around you, to move toward the sounds and voices that resonate with and support you, and to have the courage to let your own unique voice find meaningful expression in this world, in whatever form that expression may take. Thank you for listening.